I saw it.
It's a little bit squared.
Exactly. What would you like to assess first? First of all is skin quality. Okay? Skin quality is not good. The soft tissues, because she's very thin. See, she's very thin, she's skinny. And so the soft tissue tends to go down. So first thing is I don't want to put too much in same session. If she were my patient, I would tell her to start with a collagen stimulator rather than hyaluronic acid. But we can work this out because she has one thing that is visible to everyone, that is the lack of volume here. So she has trochanteric hollowness, and it goes all the way forward to the hips. So without risking any sagging, we can treat this area with GENYAL, that is kind of gentle product, and the patient is going to be happy. It's like treating with a low amount of hyaluronic acid when you see a sagging skin on the face. So you know that you can improve, but you don't want to put that much. Otherwise, the result will be the implants is there and the skin is going down, okay? It's sagging. So the best thing would be to treat this whole area, avoiding, for this time, the apex. Or, if you want to treat the apex as well, you don't want to put it here, but a little bit higher. Very low amount. Otherwise, the skin and the soft tissues is not going to hold. Okay? So about the drawings, it's quite straightforward. What I do is I press it here. Her gluteal fold comes up. She was right. The shape is squared. So my goal, my endpoint, is going to make her butt to be rounder. And this is going to give a nice shape. Then afterwards, we see what happens. We see if the shape is nice, and then we can add a little more. Just two things in this patient is quite critical, beside the fact that she's critical herself. The muscle has no tone, so it's very easy to pierce through. So pay attention in this case. And one other thing is the skin can stretch. So eventually you may end up adding a lot of vials. The fact that the skin can stretch doesn't mean you want to use that many vials, okay? Even if the correction is not so pleasant, be aware that in this area, you don't want to put more than 3 vials, maximum, top. So this is the part we want to treat today, okay? She also has some dystrophic deposit of fat here, so we want to make it even. This is the area here. We don't treat. We don't want to go up here. We just want to go here for today. And we can go, and we can go all the way to the front. Okay? This is the area. Now, the soft tissues is more here. So if the apex is here, this is the center. If the apex is here, I want to place it not in this area, but a little bit higher. Okay? And the whole the whole treatment will focus on here. Okay? We can use just a little bit of product to give her the feeling the buttocks is more round and more projected and lifted. Yes? Same thing on the other side. You do it.
Which amount?
Here? I think like half, like 5 ml. Yeah, yeah. In this area, like no more than 30. Okay, each time. Let me see. Yes. Yeah. Very good. You want to mark also, I think, come to this side? Yes. You want to mark also the edge of the gluteal area, like this. Always do that. And the apex is on this side, right here, so that we place our product up here. Now, one other thing, I cannot see it from a good point of view. Can anyone tell me if there is asymmetry? It looks same, both sides? No asymmetry.
There is a little bit.
Okay.
That one is a bit bigger than that one.
Okay, always tell your patient, always. Of course, we are taking pictures. Can anyone take a picture without just for the pre and post-op? Just one picture. Always tell your patient that these differences cannot be corrected. They will always be there because it's also a matter of asymmetry of the hips, of the legs, or the way she's walking. Okay? There are so many different things that are affecting a treatment, just as the face. You know, if a lip is asymmetric, it will stay asymmetric no matter what. Okay? Now, as an entry point, someone was asking me whether it's entry point or not. First of all, as a rule, try to stay as much as possible away from the midline, because the midline is the part that it's prone to get dirty. So I can either use this entry point or from here. One rule for me is use an entry point that is suitable both for apex and to the lateral part so the patient doesn't get too many injections. Okay? And that's it.
Can you mark the place that we can inject?
That we cannot inject. Oh, okay. The danger here, the only area that falls into the danger zone is here, because you're coming from up here to here to here. So it's, sorry, did I cross? Or more or less it's like this. So this area, it's the most dangerous one. But our area here?
But what about the apex?
Yeah, this is what I told. The apex is the only part that falls into the dangerous area, and it's dangerous only if you go deep. Don't have to be afraid. This one is the only part in the dangerous area, and you want to be down to the superficial fascia. This area here, it's almost out of it, so you can be 100% sure. There are some colleagues, fellow plastic surgeons, and I actually do it. When I do lipostructure, here it's even safe to go into the muscle if you want. The most dangerous part is this one. Okay? So pay attention when you're using this area for your injection. The more you go to the side, the less dangerous it is. Okay?
So injecting the apex area should be quite superficial.
Not superficial that you are under the skin, but superficial that you are under into the fat. Okay, and that's it. As long as you are in the fat, superficial fat, nothing's going to happen.
Yeah, because in that case, she doesn't have much superficial fat.
Yes, exactly. So it's basic. Every one of us has a superficial fat. Of course, she is not represented that much, but we're not going to have any problems. If you do, sometimes I ask my patient to contract the gluteus so that you see that you are still over the muscle. And if you go, trust me, even with the anesthesia, if you go into the muscle, the patient is going to scream out like, ow! Okay? We're finished.
Yeah.
Okay. Yeah, we go. To me is of vital importance is the being very, very clean and respect asepsis, because the implant is prone to get infected with extreme ease. Okay, it happened to me twice in my life. Okay, one of the patients did not respect the rules. She had injection, and the day after, or maybe like after 2 days, she went exercising. She went for training. Okay. She didn't tell. It could have been a drama, a tragic experience, because she was feeling pain, she didn't say anything, and then she left from, she was traveling, she went from Italy to Mexico, okay? She ended up at the hospital in Mexico with drainage into her buttocks because she did not respect. And one other, it was a male patient. I don't know what he did. I gave him antibiotics. I gave him everything. Probably he started bleeding and he ended up at the hospital. Okay, so pay attention in terms of respecting all the disinfection, everything. I am very, 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 very careful about it. Always use clean gloves. If you have surgical gloves, even better. When I will show you, when I go into the port for the cannula, I always have my gauze with disinfectant over it, because this is the only annoying thing that's going to happen to this treatment. Okay, all the rest safe. Okay. Now, I have prepared my anesthetic solution. It's, in this case, I had, can I have it? Like that one? Yeah. In this case, I had like 500 saline, and I put 20 ml of lidocaine. Do not exaggerate with lidocaine, because lidocaine can be dangerous in terms of adverse reaction. Sometimes what happens is my patient, they, even if they're very sensitive, they kind of feel lethargic, and the lidocaine can cause bradycardia. It's a hard drug. It's used for arrhythmia, so just administer as much as you need. Don't go too much, even if you want to be gentle with the patient, because first, if you put too much, if you're using too much saline, you don't know whether the correction comes from the anesthesia or if it comes from the hyaluronic acid first. And second of all, it can cause problems. I was once in Vietnam for a training, and the nurses didn't understand the solution, so they put 10 vials of lidocaine into the solution, and the patient at one point, she was like, she was on drugs. Yes.
Why don't you put bicarbonate of sodium?
Yeah, it's way, yeah. And when you use sodium carbonate, it's also, it burns less. It's true, but here we didn't have it. But this is minimum. We didn't have it here. But yeah, that's a good point. Okay, so yes.
Medium, large?
Medium. You want me to be here, there?
Maybe show me how you put it.
I think the entry point is going to be from here,
Okay.
on this side, so it's easy. I will not go with my hand.
So maybe I come here. Acá te molesto? It's okay here?
Yeah, no. Bueno. I don't know. Do you guys see? Okay. Okay. I need, for the entry point is the only point where I'm using lidocaine with epinephrine, so it helps me with bleeding. Then before injecting anything, first of all, use your antiseptic. Can I have the butchers? Yeah. Whatever. That's not important. Those are surgical gloves, right? The ones here. Yeah. Okay. So yeah, what I do is I use disinfectant. Sorry. I use disinfectant with like normal gloves, and then I turn into surgical gloves. I'm going from here. Yes, I'm going from here. So I don't know if I am. Okay. Watch out when it's alcohol, because it's going to erase your drawings. It's there. This one. This one?
Oh,
Yeah.
Yes.
If you're using iodium povidone, the drawings will not blur, so it's better. Anywhere I can put, yeah, thank you. Okay, this one, yes. One other thing, now in our case, it doesn't, well, we have it. Sometimes, and I'm going to show it now, it's better to, if you're using a retrograde technique, to cross the lines. So even if I could do it from one point, it's better if we choose two, because I can place streaks here, lines, and then I can cross them here, because if you cross the lines, you're creating a sort of net that's going to hold the tissue better rather than just boluses or one single point entrance. And you can use slight different depths, one higher, one a little deeper. So tell her I'm going
הוא
to...
נותן דקירה קטנה, זה יכול להיות שזה ישרוף קצת.
זה לא אכפת לו.
קצת צורף. חומר מרחש.
Okay?
Yeah.
Okay. She's feeling more comfortable now? Yeah?
I don't know.
She said no.
Okay. At least she's honest.
לפחות את כנה.
Okay.
זה פחות נגיד.
זה כבר
The cannula I'm using today is a 16 gauge, but the product comes out easily even with an 18 gauge cannula.
עכשיו הוא מזריק לך את השני.
So try to stay as much as away from the midline. And this is it. Then I will proceed with the injection of my anesthetic solution. See? Can you tell her not to cross the legs? Here it's important that your patient doesn't cross the legs. Yesterday I told them, because I'm superstitious, now they want to be in a flat position. Okay, so here. If you help me out, I will. Okay. I usually use like 20 ml syringes, so I don't have to go in and out too much time, but it's the same. So just tell. Yeah, this is anesthesia. So tell her that she's going to feel something, nothing really painful, and afterwards she won't feel anything.
הוא עושה לך עכשיו הרדמה, בסדר? זה היה רק נקודתית, עכשיו אנחנו הולכים לפזר קצת יותר את ההרדמה, יכול להיות שתרגישי טיפה כזה.
Where are the cannulas?
כזה, בתחושה טיפה חלשה כזה, או... אבל זהו, אבל זה חולה.
Usually, I have someone to help me when I do this procedure. So I take off my gloves, like regular gloves, and I put on good ones. Yeah, if you can help me. Really, what matters most is to be clean. If you're clean, you're safe. Yes. Can you put some? Yeah. Okay. Usually, I don't know how she will react, but when the soft tissue is a bit atrophic, they don't feel that much pain because you're not going through adhesions, okay? But, having seen the way she's nervous, she may complain about anything. That's fine. So from this entry point,
הוא עשה לך כניסה, ואנחנו נכנסים עם הקנולה עכשיו. יכול להיות שתרגישי טיפה לחץ.
okay, the needle I'm using, it's a little small for the cannula, so you need to enlarge. I'm going to have to enlarge the entry point a little bit more.
I don't think we have bigger ones.
That's fine, that's fine. So now what I do is the anesthesia first, and then I'll let you try the other side. When I go in like 1 centimeter, no more, and then I turn parallel, okay, or tangent. What I want is to give my patient a comfortable feeling. So I am injecting anesthesia while advancing. So I'm always in a tissue that's been previously anesthetized. Yeah. Pain?
No,
Is she okay?
no,
Okay, cool.
she's sleeping now.
So the anesthesia also helps me out checking if what I thought was right. Because if just with the anesthesia, the shape of my buttocks is changing in a positive way, it means that my plan was good from the beginning.
It's like a demo.
Yeah, it's like a beta version. So here, see, it's just 10 ml of anesthesia. She's comfortable. Now she feels more into it. She doesn't feel any pain. Just imagine a patient like this, if she starts feeling pain, it's a nightmare. So I rather not go out with the cannula, but just exchange the syringe. Can I have the, what is, not, I just need the, yeah. Well, it's the same. But then we need to prepare another one for a sister because now it's contaminated.
Yeah.
Well, that's fine. So I don't go out. My gauche is filled with antiseptic, and I always keep it in place, always. Again, I go in. What I feel, just to tell you the feeling, you hear like a click. Click. If you hear that click, it means that you pierce through the superficial fascia. Okay? You can even help yourself with the other hand. You go like click, and you are in the superficial fascia, and you know, because now you are in the fat, and moving in and out, it's way easier. Is everything okay with her? Yeah?
לא רואים, מה לא רואים? אני רוצה לראות איפה תזריק, לא רואים את השטח שאני כזה. לך שמאלה. לא, שמאלה אני לא יכול. תבוא מלמעלה. תעמוד על הכיוון. אז תצטי את הידע קטנים, אני רוצה לחבר פרויקציות.
עכשיו זה כבר החומר, נכון?
Another one?
Yes.
It's not contaminated.
What? Yeah, sure, yeah. Do you want to try the anesthesia on this side? It's even easier. For the beginning, it's easier than
Okay.
injecting the hyaluronic acid. Then if you feel like injecting the hyaluronic acid, you can do it on the other side.
Bravo.
So see, the shape of the buttock is already changing by administering anesthesia. And I am dissecting the the layer of the injection. I already know. Just be aware that you want to overcorrect a little bit, because when the fluids will be absorbed, then you're going to see the real result. Okay? So one more, and we're done. So now I'm trying to go all the way to the front, because she's lacking volume also in the front. Here. Then for the next one, if anyone is volunteering, it's not that I don't like you, but you don't want to be my assistant, unpaid assistant for the second time. Otherwise, I'm going to have to pay you for next. Okay, here we go. Done? Okay. So she is trying the other side. You go. I'll be your assistant. But I'm very expensive as an assistant. Can you? Okay. So Are there any other gloves like this? Okay. Wait until you exchange gloves first, and then. Okay? Everything okay? Oh, cool. So one thing, put your gauge on this side if you are injecting anesthesia on the other. I know it may sound stupid, but if you play it safe, you're really on the safe side. So you go in and you hear that little click, like click.
Yeah, I heard that.
Yeah. And you feel it. If you have any doubt, I will. Yeah, I can hold your hand. Do you prefer for us to be on the same side?
It's better.
Okay, so you come to this side. It's even easier. Are you right-handed or
I'm
left?
right-handed.
Okay, so it's easier because if you are left-handed, it's a bit tricky to go on this side. So let's wait. We need again. Yes. Can you get me one of those green needles? It's here. They're here. It's not green. Sorry.
Yellow.
Nope. It's like pink. It's pink one. Yeah. No worries. Or if there are no more, yeah, it's here. There used to be like pink gloves, pink needles. Yes.
I will give you, okay?
Yeah. Oh, you can give me the green one.
The green
Yeah,
one?
this one.
This one, okay.
Yeah, and I will. Okay.
So,
Don't worry.
okay.
I'll help you out. Okay, so this is feeling like being the real assistant. Okay.
I've been in anesthesiology. I'm not.
Yes. Okay. This is what I did with my professor. And if I went wrong, he would start beating me up all the time. Okay, you can give it to me. Yeah, it was like, you're an idiot.
כן. אותו דבר שעשינו בצד שמאל, עכשיו עושים בצד ימין.
Just, otherwise it can be a little tricky. Let me check. Okay. The dermis is quite annoying to go through. Okay.
Because
It's hard. Yeah. It's very thick.
general.
Okay, here.
Yeah.
So now you can go.
Yeah.
Here. Let me put this back here. What is
Guys, yeah.
anesthesia is here? Can you? Okay.
Anyone?
No, I give it. Yeah, we can. You need some gauges. Okay. Okay, cool. Now you talk. No, did you hear that? Like you're a bit superficial, and I'll tell you why. I'll show you why. If I go like this, I can see the tip of the cannula. If I go a little bit deeper, you see how much tissue I can elevate, and I don't see the tip of the cannula. That's the difference. This is being superficial. This is being deep. Okay, so again, she's not gonna be, you're not gonna hurt her. Just stop once you hear the click, and then you start with the anesthesia. Yeah, okay, yeah, exactly. Did you hear that?
Yeah.
Yeah. So now stop, and anterograde, not retrograde, anterograde, yeah. Don't move, just, it's a bolus. And then afterwards, you can move a little bit. Don't go out. Don't go out. Okay, it's fine. Am I a good assistant? Huh? Okay. Yeah, here also. If you encounter any adhesion, you can go through, just be gentle. Because usually within the adhesion, it's because you have the septa, and in the septa there are vessels. If you are way too harsh, you can break the adhesion and the vessels, and some hematoma may occur. Nothing serious because you're still superficial, but if the patient doesn't have that many hematomas, she will be happy. Okay, so just one more here, and then, see, I was expecting for her not to feel that much pain because the tissue is loose. When you have adherent tissues, the patient is young, it's way more painful at the beginning. Here? Okay, fine. And the last one, we can place it here. Yeah. Can I have one more? This one? Okay, in the meantime, this area is well anesthetized and ready for the treatment. I'll do it this way because it's like your hands in reverse can be tricky.
זה עכשיו, עוד הרדמה?
מה קלוז-אפ? עוד יותר קלוז-אפ? לא, קלוז אאוט.
Okay, cool. Let's do this, okay? Because this side, it's more difficult because I'll do this first, and you can do this one. Okay, so now we're done with the anesthesia. We can throw this out. Now it's time to use, eventually we came to the hyaluronic acid. But if you invest your time into this, your patient is not going to feel any pain. And next time she will come more confident because she knows that the treatment itself is not painful. If she starts feeling pain, then she will think twice about having another treatment. So to me, the comfort of the patient is one of the main things we have to take in consideration. Can someone help out with the vials opening?
That one?
Yeah. Eitan? Okay. Yeah. To open the vials for me.
תן לו שיפתח, אחי, תן לו שיפתח.
לא, אני רוצה שהוא יפתח.
Okay. Thank you.
איתן, תפתח את זה מול הפרשה.
So now I have two assistants.
Professore,
No, please. That's an offense to me.
professore, egregio professore.
Okay. So I want to start from the side, okay? Because this is the main thing we want to address. And then we can, if there is some leftover, we can go here, okay? So this one goes away. Ah, no, this is the side you want to treat. I'll treat this side first. Bleeding is done. And now the patient is not going to feel a thing. See? I can move freely and she doesn't feel anything. Can you ask her to contract the muscle? Okay. You feel where you are and you start withdrawing. You start injecting. In this case, then I will inject retrograde. Always keep your cannula with the anesthetics, with the antiseptic around. And every streak is like 1 ml to 2 ml. Use your non-dominant hand to feel the cannula and go. Yeah, also. I know I'm impairing vision. Every single streak is like 2 ml. So the idea is to have 5 lines all the way here. It's quite easy. The product, it's not hard. Some products are extremely hard to inject. This area here doesn't need 2 ml, but probably 1. See, I'm encountering a little bit of addition here, so I want to go through it gently.
Well, pain.
Pain?
Yeah.
Okay. Okay.
Only there.
Only there.
Yeah. She's fine.
Okay. This was the first one, okay? So I can use another one. Grazie. I will use same entry point, and then I'll have another vial from these other entry points, so the line will be crossed. Tell her, yeah, it can be a little painful here, maybe. Okay.
No pain.
Okay. In this case, put your arm onto the edge of your drawing so the hyaluronic acid doesn't go any higher. The reason why this line is straight and solid and this one has like points is because I want to use less product on these edges rather than same amount. After the treatment, I always give massage to my patient. Always. It's pleasant for the patient, kind of reward, and also I can spread the product away better. It's like molding the product.
Anche senza iniezioni,
Sì, sono contenti. Sì, they're happy even without injection. Some patients, sometimes they ask me, can you come to my place and keep massaging me? I say, well, that's going to be a little expensive, but if you can afford, why not? Some of them, they say, you know, I can cook well. Maybe they're looking for a husband. We don't know.
Quanto tempo dura? How long
Does it stay? Well, the absorption rate is around 50%, up to 50% in the first year. then the rest of the product, the ones that stays, it stays stable forever because the fibrous reaction around the hyaluronic acid make it stable. So if the patient comes in regularly, she's gonna have a stable result for years. Like if she does it for a couple of times every 6 months, then the result will be stable and she will add just few vials each time. Grazie.
What's the maximum amount you can put in one session?
I told you it's 7 vials per side. In her case, even if 7 vials will fit, I will not do it because the tissue is loose. And if I put too much, the tissue will go down. Oh. Can you get me
Another one?
Another one.
Altri 20 di euro.
Huh?
Altri 20 euro, eh?
What are you doing now?
Now I'm doing from here to
Okay,
here.
so wait for me a second.
Grazie.
Finito.
Puoi prendere uno di questi aghi verdi?
עכשיו כולם באים לפה?
Yeah.
כולם על הטיזק, כן.
אף אחד לא בא. אף אחד לא בא.
Wait.
מי שהיה, ממש.
רק אני הצטרפתי. אני לא רואה אותו מרחוק. אני לא רואה אותו מרחוק.
אתה אין בעיה. מה, סיימנו את צד אחד?
כמעט.
From here?
Okay. No problem.
צילמנו סטילס לפני? והם אוכלתו לפוטוגרפיה פרימה?
I asked anyone took pictures before? Yeah?
מי צילם תמונות לפני? כאילו, לפני שיהיה לנו לפני אחרי.
Okay, the pre. Okay, but this time I gotta be here. So as I told you, if we cross the line, there's going to be more support. If I have been superficial before, I go a little deeper.
מדסוטו,
Yeah,
ברלווארי.
yes.
כמה מזרקים בצריך?
בינתיים אנחנו על 3.
הישבן שלך לא הרבה צריך.
מה?
אצלך לא צריך הרבה.
זהו 3?
כן. אנחנו בשלישי.
כמות טובה. כמו 30 מזרק של פנים.
כן, זה סמיכות הרבה יותר גדולה.
Crossing the line is one of the things that's going to help as a scaffold.
אוי, זה כואב.
It hurts.
Okay. We're finished. We should have gone all the way here, but I would need another entry point, and I don't know if she can handle this. But
She
yeah,
has the patience to it.
yeah, exactly. But yeah, we should have gone all the way here. Okay, so we need another one for here, and we're done. You ready for your side?
I think so.
Yeah, cool. Yes. So we put 3 here and 1.
אפקס.
Yes, yes.
ים כאן ליפה. מה? לא, רק אנחנו שניים פה.
אני ו...
כואב זה?
ואז זה משודר
So
ב-CNN.
the point is here, but I am injecting this side, this way.
It goes down.
Yes.
Because it goes down.
And I don't want to go too much in the middle because she also has some lack of volume here. See, you don't see the tip of the cannula. It means that I'm very deep. And the upper pole in this case, are the most important area to treat in her case.
אוי, כואב.
I think it's done. Okay, done. We can save this for later.
למה ככה?
Finished. Now, a little bit massage. Finish? Stop.
לא
לא
הראו לך,
רואים
לא
כלום,
רואים
את
שום
בכלל לא
דבר.
בזווית של פוש פוש.
לא גילחתי, לא קל לך. איזה בושה, לא עשיתי לייזר.
תביא סכין
Okay.
תגלח פה.
So now this one we're gonna save it for here, and we can start.
יש לי שאלה, את יכולה לעבור פה, ואז אני אלך לשם,
לא, היא לא יכולה, היא יורדת מהדיון.
כן?
מאוד סופר סיפור.
בצד אחד. היא לקחה את הטלפון?
חמודי.
Thank you. Yeah, you give it to her. Okay. Okay, unscrew it. Sì. Allora, this one. Tu hai lavorato al San Camillo?
San Giovanni.
Ah, in che reparto? Che facevi?
שינוי?
Ah?
Tirocinio.
Ah. Oh, perché se apre? Questo lo mettiamo qui per dopo. Ok.
Oh, 91, 92, 93.
Do
Okay.
you wash the cannula before? Like, do you wash the cannula?
No, 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 no. Just push it a little bit until you. Okay, it's already there.
Yeah. לא, שאלתי אותם, שוטפים את הקנולה לפעמים.
Okay, so now you go in. She shouldn't feel any pain.
כן,
Yes.
לכי אחת עשינו לך.
Yeah. Tuck. Wait, don't worry. Don't rush. And you go where my finger is. Go all the way where my finger is. Yeah. You feel the.
Yeah, I
that
do.
you feel. Then you go backwards. Yeah, but you have to. It's hard. Is it hard? Yeah. Yeah. 2 ml.
Up until here.
No, here. Look.
I mean, yeah,
Yeah,
from
yeah.
here,
From
retro
here
grade,
until
okay.
here.
Si può anche avanzare di più.
Sì, sì, se non sai.
Come la camicia. Io
Sì,
piego il
sì.
tessuto.
Bravo,
e
e
spingo
avanti. Sì, è come ho fatto io di là.
Facci tri. Però
לא שטחי בכלל.
Oh, let me see. No. Gliel'ho messo io, quindi non dovrebbe essere. Try when you're injecting, don't go like this. Otherwise, the tip of the cannula comes superficial. Always like this. Yeah.
חשבתי שאני מצטערת לעשות מזרקים לכל צד.
She doesn't feel any pain, don't worry. Just be aware of what you're doing in terms of lines. Okay?
לא משנה, אבל
No, you
נותן נפח לפיסיק.
That's deep.
לא, שלא יצא מצב שהוא כאילו מתקמצן עליי, הבנת? כבר יצאתי פה, השפלתי את עצמי.
למה את אומרת השפלתי את עצמי?
כי זה השפלה.
Yes.
ראש, תודה כלום, אף אחד לא מזהה אותך.
הפרוצדורה הזאת אצלי
כן, אבל שישים לי מספיק רוב.
כן, תקשיבי לו מה אומר.
הפרוצדורה הזאת אצלי בממשלה זה 16-17.
תודה רבה, תגיד מתנה, תודה רבה.
כן, רק 4 מזרקים.
Okay. Do you, if you put like, if you want to put regular gloves, you can feel how it feels.
Okay?
Yes.
Should I
Yeah, you can go all the way here.
וואי, זה כיף שתכף מסיימים, נכון?
אני יותר רגועה עכשיו?
This is why anesthesia is so important because see, you can go up. Okay.
אדישה, אדישה מתה. אחותי, אני ההיפראקטיבית היא אדישה מתה.
Yeah.
מה? תגיד עליהם.
Come. Give me your hand. Put your hand up here. Yeah? Yeah. So, wait.
רק לעזור לה, אז מה?
See? Oh, watch out. See? You're going through. This is superficial because you're going to wait.
deeper?
Yeah. See?
I'll have to see.
You have to feel like tick.
Give me. Can I?
Yeah. Yeah. That was it. Then don't turn, but keep doing like this because if you go like this, you're going superficial.
All the time deep.
Yeah. All the time you want to be deep. Okay? And then so you're here and then you release the product.
Can I inject?
Yeah. I usually do it like this, not with my finger, because it hurts and you can give more pressure into it. I just,
We have to make five lines.
Fine lines,
Five
yes.
lines, yes.
Yeah.
1, 2, 3, 4.
I did it already, so you have like 2, 3 more here.
סולפנים, תאזינים?
Okay?
So to inject here.
Yes.
לא, נתנהג יפה.
Here. Here.
נתנהג יפה.
And then the last one will be
תיקח פד עם אלכוהול קצת שיהיה לך באזור.
yeah. What? There. Yeah.
Like this, yes?
Yes.
To inject?
Here. Inject here. See?
Inject it.
Yeah, but there is still like a lack of volume in this side. Then I go to the other side.
La prossima è più secca di quella.
Sì, ho visto.
בואנה, זה יפה. זה יפה, זה סקסי.
It's good?
Yeah.
מוגזם.
Yeah.
את לא יכולה מוגזם.
תשתתפי במרפסת, המטוסים...
Here, stop here, because this is where the edge of our.
I have to stop here.
Yeah. Yeah.
And there is still one.
Yeah, you can use it like go straight.
I think
Oh,
here.
yeah, exactly. Wait. Yeah. All the way here. Yeah. See? Because there is hollowness here, so if you place it. Okay. I'll go. Say 2.
Mezzo, sì, ma mezzo culo almeno.
Ah?
Mezzo culo almeno lo faccio io.
Per me puoi fare anche tutto, perché se lo fai fare vuol dire che ho spiegato bene. È colpa mia. Ok. È colpa mia se non sapete farlo. If you feel like you can do it.
בואנה, איזה יפה.
Può. Da qua.
We placed. No.
Questo il quarto adesso?
What? This is the fourth? No, third. Quante ne sono? Perché noi abbiamo messo 7 e 8, quindi abbiamo messo 3 e metà. Ok, quindi devo mettere terza. No, basta. Finish.
So you have to inject also here.
Yeah,
This line,
yes.
5 lines also, yes?
Yeah, and then with the half we have remaining,
for the apex.
she's going to do the apex.
My question, we have to put also here? Or
No, here there is the edge of our drawings. See, if you're putting product here, you're enhancing this fat.
from here
Yeah,
to here?
yeah.
To be round,
What?
to be the round shape.
Yes, to get it rounder. I don't know how round this will come at the end, but it should be better than. Usually, I don't let my patient up without the dressing. Yeah. Yeah.
חוצפנית, שאני טעה.
אני שרופה עליי. איפה את?
I do it because I need to speed up operation, otherwise you guys get bored. But yeah, cross the lines in a deeper plane.
כולם פה? אוי.
Okay, and then the rest, there is half vial there, like here, that one, yeah. Thank you, sorry. I'll come back onto the other side. And again, I go a bit over the apex. Oh, sorry. כואב. Yeah. This is the most dangerous part. So try to be superficial, but not too superficial. Okay, finish. Yeah. Okay, now. Grazie. Thank you. Wait. Now, usually, I don't let my patients up without the dressing. Do you have like small band-aids? The one, yeah, the one like I, yeah. You're welcome. Now I'm gonna ask her to stand just for a little, and then to put the dressing on. What? In terms of sitting, she can sit easily. The only thing she shouldn't do is lying down on the side, at least for the first few days. But she can sit, she can stand. When you sleep, she has to sleep on her belly, if anyone can tell her. A little bit massage. So you will see here that there is a little of overcorrection, because then the anesthesia will be gone. I'm just waiting for the little band-aids, and I will ask her to stand. Yeah, usually this is that's what I use, but I don't know if they.
Instruction after?
The instruction is not to shower for 24 hours until she can take the dressing off on her own, and no exercising, no training for 5 days.